the Medical Assisting Lab. My name is Amanda Harris, and I'm the clinical instructor. And today, we're going to go over a few tips and tricks for giving your patients clear instruction. Let's get started. We're going to start with the scale. The balance scale that you see on your left and the digital scale that you see on the right. Now, when instructing your patient, the first thing that we always do is introduce ourselves. Hi, my name is Amanda. I'm the medical assistant. Could you please state for me your name and date of birth? Thank you so much for coming in today. Please step right this way, and I'll go ahead and start with your body measurements. Now, if you could please remove your shoes and step up on the scale. Now, depending on the scale that you're using, you will either, if it's the digital scale, turn on the power button, shown here, and then once these zeros come up, your patient may step up and get weighed. When using the balance beam scale, shown here, you will first take this and move that weight to 50. Then you will move the bottom weight across until this right here drops down. Once this drops down, you can move the top weight back. It will fluctuate. Then once it is centered, you take the two numbers and you add them together. As you can see, this says 250. This is number 39. You see where the 38 and 40, and in between those are the odd numbers. This is 39. 250 plus 39. Did you get it? 289. And that is how easy it is to give your patient proper instruction on using the scale. Now keep in mind, if your patient is not wearing socks, you will need to be placing a piece of paper over the scale. When we measure a patient's height, the patient is instructed to please step up to the stadiometer. Make sure that you no longer have your shoes on. Face forward, stand up straight, chin level, facing forward. Now we need them to do this because if their height is off by, let's say, 2 inches, then they would need to go and have a bone mineral density scan done, and we don't want to cause our patients any undue billing or tests that they don't need. Therefore, we need to do things accurately. So, we will raise this up for taller patients. This top piece has to be flush across the crown of the head. It is okay while the patient is standing here to walk around to make sure that this is flush, as you can see here. Now, to read a stadiometer. We all know that there are 12 inches in 1 foot. As you can see here, the number 60 is bold. It's bold because that is 5 feet. So today, this is my height. So 66 inches. 66, because 60 inches is 5 foot, 61 is 5'1", then you see 5'2", and so forth. So 66 would be 5'6". Now, for these little graduated marks that you see here, you know that on the red line right here, we're going to count each of these marks. 1, 2, 3, 4, and 5. That means that there are 5 parts of an inch. Now, how many more before we get to a whole inch? Well, there's 6, there's 7, and then there's a whole inch. So that means 8/8, right? Because there were 8 1, 2, 3, 4, in that long line right here, 5, 6, 7, and then 8. So there's 8 parts to an inch on this ruler. Our patient is at 5 of those. Therefore, our patient is 5'6" and 5/8. Once we are done, we push the stadiometer back flat against the wall, and we are finished. Now, this is a pulse oximeter. As you can see here, PRBPM means pulse rate, that's a picture of a heart, and beats per minute. The number that's displayed on this side of the pulse oximeter only shows the heart rate. Down here gives you a battery warning light if your batteries are low, and it has percentage of SpO2. This is for the oxygen saturation of the blood. The number that's printed on this side that shows up will always be the oxygen. The number that's on this side will always be the heart rate. To turn this on, we simply touch it, and then our patient's index finger will go into the pulse oximeter, and then we wait. Now, your patient cannot have any type of artificial nails or a thick coat of nail polish, otherwise this will not work. So what we can see here is that the oxygen saturation is 98%, and my patient needed to have this facing me. Now it's upside down. I press the button, and now I can see it's right side up. Again, my oxygen is still right here. That never changed. My heart rate's still right there because it's printed. Okay, so 98 on the oxygen, 61 on the heart rate. We do not use these in a clinical office to record the patient's heart rate unless they have a condition where it is too difficult to read the heart rate. That condition would be something on the lines of extreme tachycardia. They may be taking medications that have an increase in heart rate and rhythm, in which case we would use this, but we would document that it was an irregular heartbeat.